Hello, guys. So we're going to continue with the next chapter. And the next chapter is hormones or, drugs that mimic hormones from the adrenal gland. In this chapter, we're going to notice, or we're going to emphasize how those drugs that mimic hormones from the adrenal gland, the main use is for to control inflammation process. So before we go into details, let's do a quick review of anatomy on the hormones we're going to be talking about. Let me share my screen. Okay, here we are. And this is the adrenal gland. The adrenal gland is located on the upper part of the kidney. And when we do a transverse cut, the adrenal gland is divided mainly into medulla and cortex. Regarding the medulla, we already talked about those hormones. That's epinephrine. That's where epinephrine is made. So we're going to emphasize our attention to the cortex. And the cortex, basically, we're going to be talking about cortisol, aldosterone, and we're going to mention androgens. So those are the three main hormones that we can find on the cortex of the adrenal gland. So regarding cortisol, cortisol is known to have a glucocorticoid effect. Gluco means glucose. So cortisol, when it's released, is able to increase the levels of glucose. Why? Because cortisol is released where we are under stress. So now we can complete the whole fight or flight picture. Every time we're under stress, every time we're scared, every time we're in danger, the first reaction from the body is the release of cortisol. And it takes a fraction of a second to this to happen. And then once cortisol is released, then the sympathetic nervous system will get activated, and now we'll have a full-blown effect of the fight or flight system. Aldosterone is considered a mineral corticoid. This means that aldosterone is in charge of sodium and potassium balance. And all this is going to happen at a kidney level. And the androgens are in charge of providing male-like characteristics. The amount of androgens, it varies from gender. So females, they also make androgens, but in the amount that is not significant for their body to become male-like. Unlike males, will make more androgens. Okay. Now, regarding cortisol, take this away. Regarding cortisol, also has the effect of controlling, no, not controlling, we're going to use the word inhibiting white blood cells, and because of this, also inhibits the inflammation process. So most of the drugs we're going to be talking today, this is what the main use, to inhibit the white blood cells and inhibit the inflammation process. And we know those drugs as steroids. So all the steroids, they behave like cortisol and a little bit like aldosterone. And that's where we're gonna see the adverse effects. Okay. So let's talk a little bit. Okay, this got stuck. Too many orders, I guess. Oh, there it is. Okay. So regarding indications of steroids, now using the word steroids for the drugs, steroids are used for control slash, inhibition of inflammation. Man, what's happening to me? Inflammation. There you go. And basically, we can say that is used for every itis that we know of. So you can say pharyngitis, itis, pericarditis, pneumonitis. What else? Enterocolitis, arthritis. And well, you get the idea. The only thing that you need to remember, steroids are not used for gastritis. This is the only itis that I cannot use a steroid for because it's going to promote ulcers. Steroid cannot be used when a patient has gastritis because it's going to promote ulcers. Or if the patient already has ulcers, well, that's an even bigger contraindication. The other contraindication where we are not going to use steroids is going to be on infections, and that has to be bacterial infections of the central nervous system. So here we can say bacterial meningitis. Unfortunately, sometimes we have to make tough decisions, and an inflammation in the central nervous system is not the best thing to have on a patient. But if I use a steroid on a patient, on a kid that has bacterial meningitis, then I'm gonna block the white blood cells, I'm gonna block the immune system, and I'm gonna allow that infection to move forward. And this is a vital organ. So that's another contraindication where not to use steroids. Same thing, it could be bacterial encephalitis and bacterial infection in the central nervous system. So recapping, the most common use of steroids is going to be to treat inflammations. Every itis that you can imagine, we can use a steroid. The only time we cannot use steroids is when that itis is in gastritis, because it's going to make it worse, or bacterial infections in the central nervous system, bacterial meningitis, bacterial encephalitis, because we're taking away that line of defense that the body has to prevent the spread of the infection. I give the steroid, I take that line of defense away, and basically I'm killing the patient. So we have to be very, very careful on that. Now, regarding the adverse effects of steroids, we have to go with how they work. And really mentioned, they have a, oops, take this away. They have a glucocorticoid effect. So it means the patient is going to have hyperglycemias. What patients we don't want hyperglycemias? Patient with diabetes mellitus. So if for some reason this patient is diabetic and the doctor provides a steroid, we need to emphasize your glucose levels are going to get affected. You need to start rechecking again your glucose levels at least 4 times a day and make sure that you don't have hyperglycemias. Regarding the mineral effect, it's a retention of water. Why? Because when steroids are given to a patient, they're going to hold on to sodium. Sodium stays in the body. Who follows sodium? Water. So that means we're going to have more fluids in the vascular system. And I have to put it here. Vascular system. Retention of water in the vascular system. Who's in charge of moving all this fluid to the body? And that will be the heart. So if the patient already has a heart condition or heart failure, we need to monitor this patient closely and look for signs and symptoms of heart failure complications. Same thing if the patient has a healthy heart. Same thing on the follow-ups. We have to make sure that the heart has proper function. And then we have been emphasizing that the steroids, they have a immune suppression effect. And that's the reason we use them. Because they block the white blood cells, and by blocking the white blood cells, we can control inflammation. But what happens to a patient that need to take steroids on the long run? Well, now they're going to be more susceptible to infections. What type of infections? Opportunistic infections. That means parasites and fungal infections. That's what we're going to see first, like candidiasis. Oh, okay, I'm struggling. Infections by candida. Better. And this is basically thrush in the mouth. We're going to see minor infections becoming more often and more severe on patients taking steroids in the long run. So those will be the adverse effects that we need to follow. Now, the abuse of steroids can lead to a syndrome very characteristic that we call Cushing syndrome. Cushing syndrome, right here. The most common cause is abuse of a steroid, but also can be caused by excess secretion of ACTH. For some reason, and again, it could be a tumor in the pituitary gland, and the pituitary gland starts making too much ACTH, and that's going to stimulate the adrenal gland to release more glucocorticoids and mineralocorticoids. So the most common cause so far is the administration of steroids, long-term or large doses. Usually when we use steroids, we go a few days, not even a week, when, okay, that's enough, let's move it away. Unfortunately, patients, because they see that the effects that they have and how amazing they are, they can abuse of the drug and eventually have a adverse effect, what we call it Cushing syndrome. And Cushing syndrome is very characteristic on the changes that we see in the patient's body. The main one is the moon face. The moon face the face becomes very round, like a full moon. So we call it moon face. And then we're gonna see accumulation of fat tissue between the shoulder blades and the neck on the back. And we call it a buffalo hump. So patients abusing of steroids, they're gonna have a buffalo hump. And also, they're gonna accumulate fat in the abdominal region. And this happens so fast that you're gonna see constant stretch marks in their skin, especially abdomen. Abdomen, they have a lot of stretch marks. Besides this type of obesity, we call it central obesity, because when you see the arms and legs, it doesn't match the obesity that they have. The arms and legs are very, very thin. For some reason, when I see this type of patient, I imagine like a chicken. You know, they have a big body, but very, very thin legs and very, very thin, wings, arms. So they're gonna be obese. They're gonna have hyperglycemias. Some of them, they turn diabetic. So they're gonna have hyperglycemias. We're gonna run all the tests. We're gonna find glucose in the urine, glycosuria. Fasting glucose tests are gonna be high. Steroids, like we mentioned, they also interfere with sodium and potassium balance. So people that abuses of steroids, they're gonna retain sodium. So that means they're gonna retain water, and that's gonna produce hypertension. The hypertension is because of the fluid and electrolyte imbalance, or water sodium imbalance. So this is what we see when we have a patient with Cushing syndrome because of the abuse of steroids. We remove the steroid away from the patient, and physically they may regress back to their normal body, but not 100%. Now, sometimes the adrenal glands, they don't make hormones. And that's what we call over here, where is it? Addison's disease. So now we're going to the other extreme. Addison's disease, adrenal cortical insufficiency. So now we have a patient that is not making adrenal gland hormones, is not making cortisol, is not making aldosterone. So now we're gonna see the opposite. Now we're gonna see hypotension. Why? Because instead of retaining sodium and water, that sodium and water is being pushed out. So we call that, what's happening? Hyponatremia. And I told you, hyponatremia or sodium is imbalanced with potassium. Whatever happens to one, the opposite is going to happen to the other one. So I lose sodium, but I'm going to keep potassium. Hyperkalemia. Regarding hyperkalemia, the organ that's going to be affected is going to be the heart. It's going to have an arrhythmia where the contraction phase is going to last longer. It says here weakness, because again, they're not making cortisol. Cortisol is not increasing glucose levels. So they have hypoglycemia. And one thing that is very characteristic, increased pigmentation of the skin. So yeah, maybe this patient has been very thin, very weak for the longest time, but then you see pictures, and from 10 years ago, 15 years ago to present day, you can see a clear difference in skin tone. And you ask them, hey, do you use tanning beds? Do you go tan yourself on the beach? And say, I stay home. So that's another thing that we see with Addison's disease. So if the adrenal gland is not working, what do we need to do? We need to provide those hormones, those steroids. So the most common drug is hydrocortisone. And this is where you're gonna identify them. Steroids, they end in 1. So steroids is your number 1 drug. All of them, they end in 1. So let me find more examples. So we have hydrocortisone, they end in 1. I'm going to we have prednisone, dexamethasone, fluconazole, fludrocortisone, dexamethasone. So you can see steroids, they end in 1. Okay, so let's do a quick recap that we have seen on this chapter. So regarding the adrenal gland, is able to make hormones that are able to shift glucose levels, are able to shift sodium, potassium, and also they can control the immune system. Cortisol is called the stress hormone because every time we're under stress is the first hormone, the first thing that can activate it before the fight or flight symptom. Because the adrenal glands are able to manipulate or inhibit white blood cells and the inflammation process, the most common use is to treat inflammation, and I forgot to mention this, or autoimmune diseases. So that's the most common use for steroids, to treat inflammation and autoimmune diseases. Regarding inflammation, there's only 2 types of inflammation where we don't provide steroids. And we mentioned that will be gastritis, because it's going to make it worse, and inflammations due to bacterial infections in the central nervous system. So it could be a bacterial meningitis, bacterial encephalitis, and so on. If you see the word bacteria followed by nervous central tissue, then we cannot provide steroids because we're going to take that line of defense away and the infection's going to spread, and basically we're killing the patient. The abuse of steroids is going to lead to increases in glucose levels, increases in sodium and water. And that is called Cushing's syndrome. So in Cushing's syndrome, we see moon phases. The head becomes really, really round. We see a buffalo hump on the back, accumulation of fat on the back in the shape of a hump, and abdominal fat. Upper limbs and lower limbs, they become very thin. We're going to see a lot of stretch marks, and they have a tendency of recurrent infections. Again, we're blocking the white blood cells, so they have a tendency of getting sick more often. And those patients that abuse steroids, by removing the drug away, we can control most or of the symptoms, and not 100%, but there'll be a regression regarding the accumulation of fat. They're going to lose that fat, but not 100%. Other reasons for Cushing's syndrome, it could be a tumor in the pituitary gland, where the pituitary gland sends a stimulation to the adrenal gland. So we have to remove it. Usually it's going to be by surgery. Or it can be a tumor in the adrenal gland. And same thing, it's a surgical procedure. Now going to the other extreme, if the adrenal gland is not making hormones, we call that Addison's disease. So this is a patient that regarding glucose levels, they're always going to be low. So it's a patient that is always gonna be weak. And regarding electrolyte balance, they're gonna have hyponatremia, low levels of sodium, because they're constantly pushing sodium out of the body. And who's gonna follow? Water. So they're always dehydrated. Who's gonna stay inside? Potassium. So potassium stays inside, and it's gonna produce a hyperkalemic state where the target organ is the heart, and it's gonna give us arrhythmias where the contractions of the heart last longer until the heart is unable to relax, and just goes into cardiac arrest. A constant contraction, nonstop. Let me see if I missed something real quick. And then, how do you identify a steroid? All of them, they end in 1, because it's your number 1 drug. Okay, so regarding this chapter, that's it. Stop sharing over here. Okay, and I'll be seeing you on the next one.